Assalamualaikum dear viewers. Now we'll be discussing carbon monoxide poisoning. But before we start, I would like to tell you that this is one of the high yield topics. Other than forensic toxicology, it is very important in emergency medicine too. So let's begin. These are the outlines or the topics which we'll be discussing in this presentation. Properties of carbon monoxide, how does carbon monoxide poisoning works, carbon monoxide as a chemical asphyxiant, elimination, sources, incidence, causes of increased accidental deaths, carbon monoxide poisoning in the pregnancy, absorption factors, occupational risks, signs and symptoms in accordance of carboxyhemoglobin levels, investigations, treatment, and lastly we'll be discussing also the forensic toxicology, post-mortem appearance and medical legal aspects. Carbon monoxide, the silent killer, also known as the odorless killer or the invisible killer, because it is a poisonous gas which can't be seen, can't be smelled, and can't be heard due to its specific properties. It is a colorless, tasteless, non-irritating gas, as a victim while inhaling cannot differentiate carbon monoxide from normal air. It burns with blue flames, it is lighter than air, and that's why it is usually present in greater concentrations about 2 meters above the ground levels. Product for complete carbon combustion is carbon dioxide, but when the oxygen concentration drops in the environment, carbon monoxide is produced as a result of incomplete combustion, and it has a stronger bond. A mixture of carbon monoxide with 2.5 times of air is highly explosive in the presence of flame. Now looking at the differences between carbon monoxide and dioxide, carbon monoxide is the byproduct of burning fuels, whereas carbon dioxide is the gas exhaled from the normal breath. Carbon monoxide is poisonous at low doses, whereas carbon dioxide is poisonous at high doses when it replaces almost all oxygen. Carbon monoxide molecule is represented by a triple covalent bond between one carbon and one oxygen atom, and it's a highly strong bond. Whereas carbon dioxide has a polar covalent bond, in which one carbon atom is joined to two oxygen atoms. Carbon dioxide is 55% heavier, whereas carbon monoxide is 2% lighter than air. तो इस पूरी स्लाइड को हम ऐसे बयान कर सकते हैं कि कार्बन मोनोक्साइड एक बेरंग बेजायका गैस है जो अक्सर सांस में जाने पर महसूस नहीं होती। ये हवा से 2% हल्की होती है और इसकी कम मिकदार भी बहुत जहरीली हो सकती है। Now talking about the pathophysiology, carbon monoxide is readily absorbed across the alveolus and binds to hemoglobin due to its extremely high affinity, about 200 to 300 times greater as compared to oxygen. It displaces and prevents the binding of oxygen to hemoglobin due to the competition of same binding sites and forms relatively stable compound known as carboxyhemoglobin, overall reducing the oxygen content of blood and tissues. Affinity for myoglobin is about 40 times greater, which may result in direct myocardial depression, leading to different conditions like dysrhythmias, cardiac ischemia and dysfunction. तो इस स्लाइड में हम सिर्फ इतना याद रखें कि कार्बन मोनोक्साइड एल्वियोलस पर आसानी से जज्ब हो जाती है और इसकी हीमोग्लोबिन के साथ जुड़ने की सलाहियत ऑक्सीजन के मुकाबले में 200 से 300 गुना ज़्यादा होती है, जिसकी वजह से खून और टिश्यूज में ऑक्सीजन की कमी हो जाती है। Before we talk about carbon monoxide as a chemical asphyxiant, we should know what the chemical asphyxiants are. As per the classification of Henderson and Haggard, these are the gases which by combining with hemoglobin or by acting on tissue, prevent oxygen from reaching to tissues or prevent tissues from using it. मतलब कि वो गैसेस जो हीमोग्लोबिन के साथ मिलके ब्लड में ऑक्सीजन लेवल को कम कर दे या फिर टिश्यूज पर एक्ट करके ऑक्सीजन को टिश्यूज पर पहुंचने से रोकती हो या फिर टिश्यूज के ऑक्सीजन को इस्तेमाल करने की सलाहियत को रोकती हैं, उन्हें हम केमिकल एस्फेक्सेंट कहते हैं। अदर देन कार्बन मोनोक्साइड, हाइड्रोजन सल्फाइड, आर्सेन, carbon disulfide, cyanide are all the examples of chemical asphyxiants. Carbon monoxide as a chemical asphyxiant produces death due to anemic anoxia. Now what is anemic anoxia? It is a condition where the blood can't carry enough oxygen around the body to keep organs functioning properly. It is a potent cellular toxin. Carbon monoxide irreversibly binds to heme proteins. like cytochrome E3 and myoglobin, which carry oxygen within the cell, resulting in cellular respiratory dysfunction. As a consequence, there is a mitochondrial deterioration in CNS and heart cells, which require higher level of energy, resulting in cellular damage and eventually tissue damage. Once the molecule of carbon monoxide binds to hemoglobin, it shifts the hemoglobin oxygen dissociation curve to the left, further increasing its affinity and severely impairing the release of oxygen to the tissues. As carboxyhemoglobin is quite stable, cells cannot break it, resulting in cherry red color of the blood and tissues as we can see in this image. Carbon monoxide also inhibits human platelet aggregation. Talking about the elimination and its routes, it is almost eliminated through lungs. ये तकरीबन lungs से खारिज होती है and about 1% is metabolized to carbon dioxide. Carbon monoxide is not absorbed by the body after death. The half-life of carboxyhemoglobin in the fresh air is approximately 4 to 5 hours. To completely flush the carbon monoxide from the body requires several hours, and this is the valuable time when additional damage can occur. When a patient is given 100% oxygen, half-life of carbon monoxide is reduced to 80 to 90 minutes. Hyperbaric oxygen therapy or HPOT is a type of treatment used to speed up healing of the carbon monoxide poisoning. Other than that, it is also used to treat gangrene, stubborn wounds, and infections. During hyperbaric oxygen therapy, you breathe pure oxygen inside a highly pressured environment. Often the pressure in the chamber is about 2 to 3 times greater than the normal air pressure. कार्बन मोनोक्साइड की ताज़ा हवा में हाफ लाइफ 4 से 5 घंटे होती है और मुकम्मल खारिज होने के लिए कई घंटे दरकार होते हैं और यही कीमती वक्त होता है जब इजाफी नुकसान हो सकता है. 100% ऑक्सीजन पर कार्बन मोनोक्साइड की हाफ लाइफ 80 से 90 मिनट तक कम हो जाती है, जबकि हाइपरबैरिक ऑक्सीजन देने से ये 20 से 30 मिनट तक कम हो जाती है. Exogenous sources are the leading cause of carbon monoxide toxicity. High concentrations of carbon monoxide are generated during incomplete combustion of carbon-containing compounds such as wood, coal, gas, oil और tobacco. Exogenous sources सबसे बड़ी वजह है कार्बन मोनोक्साइड टॉक्सिसिटी की. कार्बन कंटेनिंग कंपाउंड्स जैसे कि लकड़ी, कोयला, गैस, पेट्रोल और तंबाकू की इनकम्प्लीट कंबशन से कार्बन मोनोक्साइड की बहुत ज़्यादा मिकदार बनती है. In cool countries, the most common source of carbon monoxide poisoning is unvented space heaters in the home. An unvented space heater uses combustible fuel and indoor air for the heating process. It vents the gases which it makes into the room. That's why doctors urge people to avoid coal braziers and low quality heaters that could cause carbon monoxide poisoning. It is possible for heavy smokers to develop carbon monoxide poisoning. Concentration of carbon monoxide in cigarette ranges from about 5 to 20 milligrams per cigarette. This can be severe enough to require treatment in an emergency room. सर्द ममालिक में कार्बन मोनोक्साइड पॉइजनिंग की सबसे बड़ी वजह खराब वेंटिलेशन वाले हीटिंग सिस्टम्स का इस्तेमाल है. Endogenous. Endogenous means having an internal cause or origin. Can anyone guess normal physiologic reaction producing carbon monoxide in our body? ऐसा मेटाबॉलिक रिएक्शन जिसमें कार्बन मोनोक्साइड की पैदावार नॉर्मल हो. Excellent job if your answer was heme catabolism reaction, when heme break down into biliverdin in the presence of heme oxygenase. Although carbon monoxide has a hazardous pharmacologic effects, but as per recent studies, it is becoming a therapeutic molecule that can potentially prevent uncontrolled inflammation in the sepsis due to its anti-inflammatory properties. Methylene chloride. Methylene chloride CH2Cl2 is a colorless liquid. It is used in various industrial processes and in many different industries, including paint stripping, pharmaceutical manufacturing, paint remover manufacturing, metal cleaning, and metal degreasing. The most common means of exposure to methylene chloride is inhalation and skin exposure. Metabolic methylene chloride is metabolized in the liver in part to carbon monoxide, which can elevate carboxyhemoglobin levels and decrease the oxygen carrying capacity of the blood. Carboxyhemoglobin levels may continue to rise for several hours after the exposure has ceased. मीथाइल क्लोराइड सांस के जरिए और स्किन के जरिए जिस्म में एब्जॉर्ब होता है और लिवर में मेटाबोलाइज होने के बाद कार्बन मोनोक्साइड बनाता है, और मीथाइल क्लोराइड का ये अमल एक्सपोजर के कई घंटों बाद तक भी चल सकता है। Carbon monoxide is one of the leading cause of poisoning deaths in USA with about 5,000 to 6,000 fatalities and emergency department visits of approximately 40 to 50,000 annually. As you can notice in the chart, there is a higher incidence of fatalities during December, January and February. It is because of winters when usage of heating system is on its peak. Factors increasing the chances of accidental deaths. It is common in elders usually aged more than 65 years, but it also depends on the health status of an individual. A person having cardiorespiratory abnormalities is more prone to the danger. एज अबाउट 65 ईयर एक मेजर रिस्क फैक्टर है, मगर हेल्थ स्टेटस का भी बड़ा किरदार होता है। मसलन कि एक आदमी है 70 साल का जिसे कोई खास बीमारी नहीं है, बट ऑन द अदर हैंड एक 50 साल का आदमी है हु इज ऑलरेडी अ पेशेंट ऑफ कार्डियोरेस्पिरेटरी डिसफंक्शन, और वो दोनों किसी कार्बन मोनोक्साइड एनवायरनमेंट में एक्सपोज हो जाए तो वो विल बी एट मोर रिस्क, of course who is already suffering from cardiorespiratory problems. Okay, I hope you guys got my point. Third point is use of heating systems in the winter with closed windows. If pregnant mothers are exposed to carbon monoxide environment, the fetus is particularly vulnerable to the carbon monoxide poisoning. Fetal hemoglobin shifts the oxygen hemoglobin dissociation curve to left. Chronic exposure to carbon monoxide in pregnancy causes growth retardation, fetal distress and death. Survivors may have developmental disorder and brain damage. Pregnant mothers may exhibit mild to moderate symptoms, yet the fetus may have devastating outcomes. Now, the absorption of gas is usually dependent upon the total air entering in the lungs per minute, known as minute ventilation. It can be calculated by multiplying tidal volume with the number of breaths per minute. Duration of exposure is very important to assess the severity of toxicity, along with the concentration of carbon monoxide and oxygen in the environment. If we talk about the occupational risk of carbon monoxide toxicity, firefighters top the list, followed by the miners, as these people are always exposed in the carbon monoxide environment. Signs and symptoms as per levels of carboxyhemoglobin. These features are not exact and may vary in different individuals. When carboxyhemoglobin levels are 10 to 20%, tightness across forehead, slight headache, dilatation of cutaneous blood vessels, exertional dyspnea can be seen. At the levels of 20 to 30%, headache and throbbing in temples, easily fatigued with possible dizziness. Severity of symptoms begins when the carboxyhemoglobin levels are 30 to 40%. There are complaints of severe headache, weakness, dizziness, confusion, dimness of vision, nausea, vomiting, and chance of collapse. Marked CNS depression at the levels of 40 to 50% with great possibility of collapse and syncope and increased pulse rate. As the carboxyhemoglobin levels increase to 60%, there is a further worsening of CNS features. Syncope, increased respiratory and pulse rate, coma, intermittent convulsions, and chain stroke respiration. Chain stroke respiration is an abnormal pattern of breathing commonly seen in the patients approaching to death. It is a type of breathing disorder characterized by cyclical episodes of apnea and hyperventilation. Mainly, patient won't survive till levels of 70%. At this level, features just lead to fatality, coma, intermittent convulsions, depressed heart action, decreased respiratory rate, and possibly death. We already discussed these features. Acute neurologic features consist of headache, dizziness, confusion, seizures, and coma. Chronic victims may suffer from cognitive and psychiatric problems. On autopsy, you can see the distinct cherry red color of the brain tissue with cerebral edema as compared to normal. Going through myocardial features, there is decreased myocardial functioning. Here, the most important point to remember is that ventricular fibrillation is the most common cause of death due to carbon monoxide poisoning. Multi-organ dysfunction syndrome. Multi-organ dysfunction syndrome may occur at high levels of exposure with increased mortality rate. Metabolic acidosis occurs with severe exposures. The inhibition of cytochrome by carbon monoxide depletes ATP, culminating in the cell death. Oxygen is unable to reoxidize the reduced cytochrome A3, thus cellular respiration is inhibited as well as ATP production, in essence depriving the cells, tissue and ultimately the whole body of oxygen, resulting in lactic acidosis. आसान अल्फाज में अगर बयान किया जाए तो कार्बन मोनोऑक्साइड की वजह से एटीपी डिप्लीशन हो जाती है और इंट्रासेलुलर रेस्पिरेशन रुक जाती है, जिसकी नतीजे में लैक्टिक एसिडोसिस हो जाता है. Respiratory alkalosis results in about 40% of the carbon monoxide poisoning victims due to hyperventilation. Pulmonary edema is uncommon in children with acute carbon monoxide poisoning. The possible causes of pulmonary edema include toxic effects of gas on the alveolar membranes, myocardial damage leading to left ventricular failure, aspiration of gastric contents after the loss of consciousness, and the neurogenic pulmonary edema. The symptoms of poisoning are often mistaken for the symptoms of influenza or the illness caused by the eating contaminated food. Victims may not notice anything except a headache until they suddenly lapse into coma and die. Poisoning के अलामात को अक्सर इन्फ्लुएंजा या खराब खाना खाने के अलामात समझ लिया जाता है. मुतासिरीन को सर दर्द के अलावा कुछ महसूस नहीं होता जब तक कि वो अचानक कोमा में न चले जाएं. The saturation required to cause death varies with the age and health of the person. Patients recovering from carbon monoxide poisoning may suffer neurological sequelae like tremors, hemiplegia, visual loss, which may be temporary or permanent. Complete recovery after serious poisoning may take many weeks. Sometimes patients become ill again up to 4 weeks after recovery. Now coming over the investigations, there are various methods for investigation of carboxyhemoglobin. Standard pulse oximetry does not detect carboxyhemoglobin, and SpO2 readings may remain within the normal ranges in spite of severely decreased oxygen carrying capacity, dropping only at very high carboxyhemoglobin levels, as there are only two wavelengths utilized to detect the levels. Recent introduction of special pulse oximeter of multi-wavelength known as pulse carbon monoxide oximeter is being used in some setups, which utilizes about 8 to several dozen wavelengths in order to detect carboxyhemoglobin levels. इसमें जस्ट इतना याद रखें कि आमतौर पर इस्तेमाल होने वाली जो पल्स ऑक्सीमीटर होती है उसमें सिर्फ 2 वेवलेंथ्स का इस्तेमाल होता है, जबकि कार्बोक्सीहीमोग्लोबिन को चेक करने वाली कार्बन मोनोऑक्साइड पल्स ऑक्सीमेट्री में 8 से ज्यादा वेवलेंथ्स का इस्तेमाल होता है. Other than oximetry, quick emergency test is used in which 15 ml of water in a test tube is taken and 2 drops of suspected containing carboxyhemoglobin are placed and mixed. Positive sample turns pink. Kunkel's test is also a rapid field test used to detect. In this test, 5 to 6 drops of 3% tannic acid is added to patient's diluted blood, which gives a crimson red coagulum, while normal oxyhemoglobin turns deep brown. In Hope-Seller's test, few drops of blood are added to 10% sodium hydroxide. Normal oxyhemoglobin turns deep brownish green, while carboxyhemoglobin turns pink. On spectroscopic examination, there are characteristic bands of carboxyhemoglobin. Non-dispersive infrared spectrophotometry and gas chromatography are analytical methods. Coming at the treatment. Always remember that whenever we talk about the treatment of poisons, first step is always remove from the exposure. हमेशा जहरीले माहौल से अलग करना है मरीज को. If the victim is conscious and breathing normally, usually no treatment is required. Any patient having carboxyhemoglobin more than 25% should be treated, despite of his features and breathing status. 100% oxygen via tight-fitting mask. Endotracheal intubation for the patients with depressed mental status, usually if GCS is 8 or less, until carboxyhemoglobin falls to 15 to 20% and GCS is improved. Carbon dioxide should not be given. Hyperbaric oxygen therapy proves to be quick and efficient therapy but has several disadvantages such as vomiting, convulsions, agitation, rupture of tympanic membranes, blocked sinuses, etc. Gastric lavage early in course of treatment may prevent aspiration pneumonitis. A whole blood transfusion is useful. Bed rest for at least 48 hours. Avoid stimulant drugs such as cocaine, amphetamines, ecstasy. Antibiotics as prophylaxis against lung infection can be given. If the patient develops cerebral edema, treat accordingly with fluid restriction, steroids, mannitol. This is the chamber used for hyperbaric oxygen therapy. Hyperbaric oxygen therapy involves breathing 100% oxygen while in a special space called hyperbaric chamber. The air pressure inside is raised to level that it is 2 to 3 times higher than the normal air pressure. The increased air pressure in the chamber helps the lungs to collect more oxygen. Now we'll be discussing the important part of the forensic medicine, postmortem appearance of carbon monoxide poisoning victim. When carboxyhemoglobin levels are 30 to 40%, there is a cherry red discoloration of skin, conjunctiva, nail beds, areas of hypostasis, blood tissues, and internal organs. In an anemic person, the color may faint or absent. In dark-colored victims, the color may be masked but may be seen in inner aspects of lips, nail beds, tongue, palms, and soles, and will not be changed by embalming or preservation by formalin. खून की कमी वाले शख्स में रंग हल्का या गायब हो सकता है. गहरे रंग वाले लोगों जैसे कि अफ्रीकन्स में चेरी कलर छुप सकता है, मगर उनके होंठों, नाखूनों, जबान, हथेलियों और तलवों के अंदरूनी पहलुओं में देखा जा सकता है, जो कि फॉर्मेलिन के जज्ब या महफूज करने से तब्दील नहीं होगा. As the time passes due to onset of decomposition, cherry red discoloration changes to dark green and then to brown. There may be blistering of skin in dependent areas such as buttocks, calves, wrists, and knees due to cutaneous edema. Congestion of the lungs with pink fluid blood, and if the victim survived for some time before death, pulmonary edema with the congestion are found and lungs may show bronchopneumonic consolidation. In delayed deaths, tiny focal necrosis can occur in myocardium. Bilateral symmetrical necrosis and cavitation of basal ganglia in the brain, especially putamen and globus pallidus, is most characteristic lesion. दिमाग में बेसल गैंग्लिया की कैविटेशन खास तौर पे पुटामेन और ग्लोबस पैलिडस पर सबसे नुमाया लीजन्स होते हैं. Other than these, cerebral cortex, hippocampus, cerebellum, substantia nigra of brainstem may be affected. Ring-shaped hemorrhages in white matter of the brain with widespread edema are seen. Hemorrhages in the meninges and cortex, necrobiosis of ganglion cells in the cortex may be seen. Homicidal cases are uncommon, resulting from carbon monoxide poisoning, unless the victims are incapacitated, adults or children. होमिसाइडल या कत्ल के केसेस बहुत कम रिपोर्ट होते हैं जब तक कि मुतासिरीन माजूर हो या छोटा बच्चा हो. The suicides following carbon monoxide poisoning are very rare. The person may be seated in his car with tube leading from exhaust into the passenger compartment, or he may lie on the floor of the garage near the exhaust pipe with doors and windows closed. Due to the weakness that sets, victim becomes incapacitated. He is unable to get up and turn off the gas even if he wishes to do so. Accidental deaths are very common, caused by flawless braziers, automobile exhaust, gas exposure in the mines following explosions, gas exposure during fires, incomplete combustion of wood, charcoal or coal in poor ventilated room. That's all for carbon monoxide poisoning. Hope you guys enjoyed the video. Please subscribe and share my channel to show your support, and don't forget to hit the bell icon. Inshallah, see you soon with a new topic in a new video.